How does stress affect patient health and recovery? I'm Dr. Michael Lee, founder here at The One Method, and thank you so much for joining me today because you're either a clinician that you're saying, oh yeah, I see patients stressed all the time, but I don't really know what the link is, or you may be a patient. You're thinking, I go to my GP, I go to my doctors, I go to my clinician and say, oh no, there's no link with stress and your problems. But I'm here to give you just my experience and also a bit of clarity in terms of what can be done to help you, especially if you are struggling with your body, with your health, if things are painful, if you've got diseases. But essentially, I'm going to help you in terms of getting clarity in terms of what you can do in your next steps as well. So the thing is that when people have got really poor health, what tends to happen is that, yes, they're in pain. When they're in pain, they're generally very grumpy. When you're really grumpy, then you get really depressed. When you get really depressed, they're not really the type of person people want to hang out with. So what tends to happen is that it's this downward spiral, right? Where actually life gets worse, the people around them don't want to hang out with them, and it's because actually something's created this. Because every patient actually follows this kind of, journey in life. At some point in your life, everything works fine and dandy. Everything's perfect. You do what you want, when you want, having a good time, see friends. You can do all the things, your sports and hobbies that you love doing as well. But the thing is that something generally happens, a big trauma happens, and then things start to break down one thing after another. But sometimes it can be an emotional trauma. I know some people say, no, Michael, how can you link emotional trauma with a physical pain? Well, just think about it. When you stress, what happens to your body? Is it really relaxed? Then you can do what you want? No. When you are stressed and you have an emotion, things tense up. Unless you can prove otherwise. Or you can tell me if you're one of those people that when you get more stressed, you tend to just shut down and go, oh yeah, I'm really relaxed when I'm stressed. No, that isn't what happened. The physiological behavior when people get an amount of stress is things start to tense. And when things start to tense, it can then have a knock-on effect on blood flow, because when things are tensing, things are being compressed. When things are compressed, of course, blood flow is going to be reduced. And the other thing, the importance of blood flow is, of course, it has all of your immune system, has all your nutrition, has all your oxygen that gets to the area to help your body survive. So with a restriction in blood flow, is that going to affect your health? Yes or no? Of course it's going to affect it. So if someone's in prolonged stress, which is essentially prolonged bracing or tightness in their body, is their body going to break down over time? Maybe not. It really depends how robust the person is. But if they're not very robust, the chances are it's going to break down very quickly. But the thing is that not many people tie these things together. Think, oh no, mental health, bodily health, they need to be separate. It's a bit like saying to a running coach, oh yeah, do you know what? To run, you only need your feet. You don't need your knees. You don't need your hips. You don't need your back. You don't need your arms. You don't need stability. You need everything because the whole body is interconnected. And we need to really make sure that we understand how each area of the body actually works together. Because the people say, oh no, you need to treat things as little small pieces and they're not connected. They're very short-sighted. The reason why they're short-sighted is because actually they don't understand, because their knowledge stops in one area. And actually, they're too proud to actually admit that actually I haven't done the education. I haven't done the learning to find out how things are linked. I'm blessed. I say blessed or cursed, whatever you want to put it. I'm blessed that I've actually studied 7 degrees to find out how the whole body's connected, but cursed because I had to, because I was in a wheelchair for 2 years, right? I wasn't content with being in a wheelchair for 2 years, but I had to find out how the brain, the mind, the body, the nervous system interconnects together to find out how and why things break down in those particular times in people's lives. So let's look at the next bit in terms of stress. Does stress affect patients? Of course. Does it affect people? Of course. But the question is, can you get rid of stress? No, it's impossible to get rid of stress, because just think about it. How many people in the world are stressed or have experienced stress? Everyone. But the question, what creates stress? What creates stress is actually people, right? If you were left your own device to do what you want, when you want, the chances are you won't be stressed because you won't be surrounded by people you don't like, because you get that choice. But if you're surrounded by people that create stress for you, right, the only way you can get rid of that stress is by getting rid of the people. And from my point of view, if I remember correctly, killing people is illegal, right? So you can't kill people, but you can actually disconnect to get rid of or not be part of their lives. That's a way of getting rid of the stress. But ultimately, everyone has stress in their lives. It's about finding out how do people manage stress? How do they manage it? Because it's going to happen anyway. So we know that stress is inevitable, But the other question is, how come some people manage it well, but some people manage it badly? And I'm going to be very honest with you here that when emotions actually happen, emotions can either benefit people or they can destroy people. So you look at the emotions that benefit people, joy, happiness, excitement, love, it can really bring out the goodness out of people's hearts. But the emotions that kill people, depression, anxiety, destruction, anger, frustration, right? All those things, they don't help. Just think about it. I've never met someone that says to me, oh yeah, I was really anxious the other night. I didn't sleep all night. And, I really had a good time doing that. People don't say that. Anxiety doesn't serve a purpose other than destroying the person. Right? It's not going to help that person. It's not going to build them up. It's not going to improve their quality of life. It's not going to make them feel better. If anything, it's just a steady decline into destruction. But at the end of the day, when I see a lot of people in the world, is that you always think that everything in the world operates in polarities, right? Or dualities. You have people that are positive, and people that are negative, and people that are happy, and people that are sad. But at the end of the day, you cannot have both at the same time. They're opposites. But you also have people that will build people up, and also people that destroy people. The people that will destroy, right, stay away from them, because they don't want to help anyone other than themselves. They're actually very selfish people. But if you have those people that are creating stress in your life, disconnect. I urge you to disconnect. But ultimately, here at the One Method, we're here to find out whatever something's happened in the past. The brain, called basal ganglia, may have created a protective mechanism for a previous emotional trauma that causes pain and diseases in the body. If that has happened, then of course we go and treat it. We treat it, and then the system will then operate normally prior in terms of how it was before that incident. But this is where it's about finding out exactly what's happening in a person's body, because there's not one person, not one patient that is actually exactly the same. Every person is unique. This is why you need to do your assessment, because every person's upbringing is unique. Every person's values are unique. Every person's anatomy is unique. Their physiology is unique. Their movements is unique, right? Their behaviors is unique. Their traumas are unique. So how can you just do the same thing for the same person every single time expecting the same result? Because you won't get it. You need to see every person as a person, not a number, and then really ask them the right questions to get to the root cause of the problem. And this is what we do at the One Method here, and I really hope that you found today really helpful. It actually makes sense, because it's about tying things together. And I've done all the heavy lifting, I've done all the studying to find out what works. 80% of what I studied in the 7 degrees is total nonsense. They just treat symptoms, but the 20% treats the cause. And this is why when I see lots of clinicians that come with the courses, I say, look, when you do that manipulation, when you do that talk therapy, when you do that massage, that myofascial release, that acupuncture, is it treating the cause or the symptoms? When you're stretching, cause or symptoms? Symptoms. So that's why I say we don't treat it that way here. We get to the root cause and find out where it started. We'll treat that, then everything that was compensating after that disappears, and then the body operates exactly how it was before the trauma. So if you're a clinician and you're looking to learn this method to find the root cause, and you're kind of sick and tired of doing massages all the time or manipulating all the time because you know that the pain just keeps coming back in patients, or actually their neck pain just keeps coming back, or they just cannot manage the stress, well, I'd like to offer an opportunity. An opportunity here that yes, we are doing a live event early next year. If you would like to get more information and some special offers about how to get to the root cause of the problems, let me know and just put me in a chat, and one of our advisors will come and contact you to find out when our next availability is. Because yes, we always do sell out, but ultimately it's about making sure that you are positioned as the best expert, because everyone that comes on the course, essentially, they are on their bad day when they're treating patients. They're still better than 99% of the rest of the world anyway. And they always get the results, even on their bad day, on their worst day. And that's why we love helping people, because our mission is to help as many people as possible so they have the opportunity to live healthier and happier lives. So if you have that same passion as well to get to the root cause of the problem and truly help people, this is for you. But if you're happy just treating symptoms, this isn't for you, because you would have a different value than we do. So, but I want to thank you for being here anyway. And if you have any questions, put them in the chat. Other than that, I'll see you after Christmas. So have a wonderful Christmas, and see you next week. Bye for now.